Hi, my name is Callie Hatch and I'm doing the lab for external eye and ear exam. First thing I would do is introduce myself, do hand hygiene, and provide privacy for the patient. I would then identify the patient and name, date of birth, and explain what I'm going to do. It is very pertinent that you have clean hands or clean gloves. In order to do this exam, you do not want to contaminate the eyes. So I'll be using my husband as a subject, and we'll go ahead and start with the assessment. So first thing you're going to do when you walk up is look at the patient, make sure things are symmetrical, make sure that there's no drooping, the eyelids aren't drooping or unable to close. The exam is going to include the eyelids, the canthus in the corner of the eye where the lids meet, and the inner canthus or the cornicle, which is the small fleshy mass with the sebaceous glands. The lacrimal apparatus is also referred to as the tear duct, is in the corner of the eye. It keeps the conjunctiva and cornea lubricated. The inner canthus is where it drains to, and it leads into the ducts into the nose, and this is why your nose runs when you cry. Although the cornea, iris, and pupils are not considered part of the external eye, they will still be assessed during the external assessment. Exams would include visual acuity tests assessing muscle strength and visual fields. So what I would do is walk up to the patient. I've already explained to them what's going to happen. I'm going to look at if they can raise their eyebrows, squint their eyes. I'm going to do accommodation. I'm going to take my finger and tell them to follow my finger. And I'm going to go in, out, side. I'm going to look for nystagmus. I'm also going to have them cover one eye and tell me if there's any blurred vision on either side, any discrepancies in vision by covering one eye or the other. I will also do the visual fields exam where I will tell them look forward and tell me when you can see my fingers. So I'll bring my fingers in, yes, from different angles to make sure there's not any lack of vision in any part of the eye. I will do this on both sides. This is also done during stroke evaluations to make sure there's no loss of vision field. I'm also going to do the standard PERLA where I'm looking at pupils equal and reactive. So I'll have the patients look forward. I will take my light and I'll come from the side, make sure that it's reactive. You can look at pupil size, make sure it's reactive to light. You can also look at if there's any abnormalities to the pupil or the iris to make sure it's not shaped funny. You're also going to look at the conjunctiva inside here, making sure it's not yellow or pink. Pink would indicate possible infection, or pink eye, where yellow could mean jaundice. You'd also pull down and look at the inner eyelid or the inner conjunctiva to make sure it's a pinkish color or sometimes brown, depending on the person's skin color. And then I would just make sure that the eyelids aren't drooped or any abnormalities or discharge on the eyelids. If you have the eyelashes visible, you can look for also lice in the eyelid or eyelashes, which oftentimes is occurring when there's people get the fake eyelashes in, they're getting infections and discharge and possible lice in that area. I want to make sure that the eyelids are closed completely, they don't droop, the eyelashes are evenly distributed, there's no redness or swelling or deformity to the eyelid. I also want to make sure that the conjunctiva is thin, transparent membrane, that it's not discolored. The cornea is clear, thin, and transparent, covers the iris and pupils. It should have no opacities or blurriness to it. Shouldn't be discolored. Irises should be equal and reactive light, around 3 to 5 mm in size. And we can also do the visual acuity test by putting up the board that either has numbers, letters, or sometimes images for children, and ask them to read so we can get a visual acuity. One thing we want to look for too is any bumps or deformities in the eye. We can look for styes, growths, little deposits of fat in the eye. Next, we're going to go to the ears. The external ear examination of the ears would include the auricle and the pinna, which is skin and cartilage here, so it should be the same color as their face skin. It consists of different ridges that will help funnel the sound into the inner canal, which is also made of cartilage. In the inner canal, we should expect some earwax. It shouldn't be excessive and just should be light yellow in color. If it is black or dark in color, it could mean infection. Black usually means fungal infection. And there should be hairs present, but there should be no excessive hair growth or any weird growths within the canal. The auditory canal should be clean with only small amounts of yellowish earwax. Skin color should be smooth in texture. The auricle should be rigid in structure. Abnormal findings that we would be looking for, especially in the piña, is lesions or growths here that could indicate skin cancer. You could have keloids, especially where like the ear piercings go, or if any traumas happen to the ear, it's excessive cartilage. You could look for battle signs back here, which could mean that there's a skull fracture. So that would be back here, bruising of that nature. That would be very pertinent to tell the doctor about. An intervention would need to be done immediately. We should not be putting anything in the ear when we do these exams. We can flash a light to visualize better. So you can look into the ear, make sure there's not excessive wax. It helps to pull back the piña here, up and back, to kind of see in there. That can assist you in that. You want to make sure that they aren't complaining of earaches. You can make sure there's no ringing, tinnitus in the ear that's reported. Low ears can indicate Down syndrome, and you want to look at they're symmetrical on either side. And we also want to make sure that they're not excessively small or excessively large. And that concludes my presentation.